So we started a few years ago doing these outpatient epilepsy follow-up visits. Sometimes they're just people that need medication adjustments. Sometimes they're local people that have jobs and, need to keep those and not take as many days off work and those sorts of things. Sometimes for us, we're a big surgical epilepsy center, so we have patients from all over that may come for surgical management, and we just need to check in after surgery and saves them a flight, those sorts of things. So we started, and it was people, I think, out of state at first, and then really as it sort of caught on and people figured out how accessible and convenient it is, it started being used a lot more. So I'm always surprised because we all have stereotypes in our head of who might use these and use this new technology, but really I've had all ages, and sometimes it's nice, especially in Cleveland where we have some inclement weather, Sometimes they're planning to come into the clinic and the weather's bad, and I say, hey, you want to just hop online and let's do a virtual visit so we can touch base, and it works really well. So I've really been excited because it's really been a wonderful tool to help with patient care. So. In some ways, I was actually surprised. I think there's something different about being on a phone with someone, but the video helps that. You can see them. But one thing I actually wasn't expecting was how you could see the patient sort of in their environment. You learn more about them, not even so much from their medical comorbidities, but just the context of their disease. So some stories, like I had a patient who, I really couldn't figure out why we were struggling, and then he didn't know his medicines, and we did a virtual visit, and then I looked and he had 50 bottles. They were not organized. It was very clear to me that there was a reason behind it that I probably wouldn't have necessarily picked up on otherwise, So I think people in their home environment are more comfortable. So I found actually that sometimes you can get them to open up and do things, especially sometimes I know them well, sometimes I don't. I've actually done even new patient visits at times. So I haven't been surprised about how well you can really establish the same type of rapport, and I felt like I can still deliver the same level of care.